Hello, I'm Hannah Donnert with the Collaborative on Health and the Environment. She enjoys bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to today's first of two webinars in the series, Agents of Change, Amplifying Voices of Future Leaders in Environmental Health and Justice. Our moderator is Karen Wang, Director of CHE and founder of Because Health. We will leave time following the presentations for a brief Q&A session. You may type in questions through the Q&A feature on the menu bar at the top of your window at any point during the presentation. After the presentation, our moderator will read out questions for our speakers to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our speakers. This webinar is scheduled to last for 70 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Karen.
Great, thank you so much, Hannah. We are really happy to spotlight the Agents of Change in Environmental Health today, which is a collaboration with the George Washington University Milken Institute School of Public Health and Environmental Health News. Agents of Change is providing a space for the environmental health leaders of tomorrow to explore the intersection of research, health, diversity, and justice. I'm going to briefly introduce all of the speakers, but we'll get to know them more throughout the webinar. Dr. Amy Zoda is the founder and director of Agents of Change in Environmental Health. She is an associate professor in the Department of Environmental and Occupational Health at the George Washington University Milken School of Public Health. Dr. Zoda's work seeks to secure environmental justice and improve health equity through advancements in science, policy, and clinical practice. The four fellows we have with us today, the first one is Dr. Max Ung, who's a postdoctoral research fellow at the University of Michigan School of Public Health. He is also a health policy research scholar, alumnus of the Robert Wood Johnson Foundation. The second fellow we have is Ashley Gripper, who is a PhD candidate in the Environmental Health Department at the Harvard T.H. Chan School of Public Health. She is a health policy research scholar, a program of the Robert Wood Johnson Foundation, and an active member of Soil Generation, a Black and Brown-led coalition of urban farmers, gardeners, and food justice activists. The third scholar we have with us is Denise Martinez, who is a PhD student at UC Davis in the graduate group in ecology. She is also a health policy research scholar with the Robert Wood Johnson Foundation. And the fourth fellow we have today is Brianna Vannoy. She is a research associate at the George Washington University Milken Institute School of Public Health. So with that, I'll give it over to you, Dr. Zoda. Thank you.
Hello, good afternoon, everyone. Thank you, Karen and Hannah and the Collaborative on Health and the Environment for inviting us and for helping to organize this webinar. We've been working hard as a group in this kind of our inaugural year of putting together the Agents of a Change in Environmental Health program. And so it's great now that we have kind of a year under our belt to kind of share with you what we've been up to and help initiate some new and important dialogues around science, research, diversity, and justice. So, you know, really what I'm excited about is engaging in dialogue with four of our fellows. We'll be doing a second webinar in the fall to speak with the other half of them. But before we get to that, I just want to do a brief introduction on the program, its objectives, and kind of what we've accomplished this past year. So I have been given webinars with CHE in the past because I'm an environmental health scientist. I do a lot of work on EDCs. And this past year, actually while I was on sabbatical, I started this program, Agents of Change in Environmental Health. So just a little bit about my research. As Karen mentioned, My work seeks to secure environmental justice and improve health equity through advancements in science, policy, clinical practice, and communication. These days, a lot of my research is kind of going in the direction of really beginning to map how social structural processes like structural racism, like housing policies, shape the environmental exposome and related health disparities. So trying to bring together social scientific concepts like intersectionality with the exposome, which is kind of critical to environmental health sciences and policy. Last year, I became an associate professor with tenure. And, you know, I think now what I'm really driven by in everything I do is to maximize impact in the field through disruptive innovation. And I want to focus on that aspect of disruptive innovation because sometimes I really think we have to challenge our existing structures and systems in order for them to change. And just upon some self-reflection, I've realized that this kind of my desire and willingness to challenge systems is one that goes back way to my childhood. My 5-year-old the other day shared this observation. She was comparing me and my husband, and she was like, "Daddy always listens to his parents." And, you know, but she was like, "But you didn't really listen to your parents very much, did you, when you were young?" So I think my parents were the first system or the first institution that I challenged, and luckily they stuck with me. But that spirit, that iconoclastic spirit, has kind of stayed with me, and so you know, I kind of see this program as an outgrowth of that. So the problem that the problem and the reason why I thought about doing something like the Agents of Change program is I think science communication is really key to creating change and moving the science into action. Science communication can come in many different forms. I think in this space of the double pandemic, we're realizing how critical it is to have good messengers of the science. But I've also realized that the majority of those messengers tend to be, especially in the environmental health field, tend to be predominantly senior white men. And a lot of the times, the messengers of the science to the public also become our de facto thought leaders in this space. And they really have a critical role in shaping public dialogue around science. And in this kind of moment that we're in, where there is a lot of distrust around science and experts, I think part of it is also our relationship to sharing the science with the public. And so I kind of saw this as a problem that I wanted to engage with. And one solution I had was to amplify neglected voices in environmental health and really help foster a new generation of more diverse and inclusive thought leaders. So that was kind of what I thought we really needed in the field. This is not something that me as an academic could really do effectively on my own. Our early success is really a result of this strong partnership between, you know, an academic institution like GW and Environmental Health News. So I think a lot of people here know about Environmental Health News. It's a nonprofit, nonpartisan organization dedicated to driving science into public discussion and policy on environmental health issues, including climate change. I approached them. They were super excited about this partnership. And Brian Bienkowski, who's a senior editor at EHN, has become the editor of the Agents of Change program. So he's been critically involved in our workshops, in providing detailed feedback to all the fellows on their writings. And EHN hosts and publishes all of our blogs or essays, both in English, and we have also had all of them translated into Spanish. So, and we were lucky enough that to get some funding both last year and this year from Marisla Foundation to support this initiative. So what are our program goals? One is to increase the impact of early career scientists from underrepresented backgrounds. And we hope to increase the impact of their work by training them in next generation science communication skills, giving them this platform to communicate directly with the public and to test new ideas. The big part of this experience is giving feedback and receiving feedback from their peers. So there's a kind of cohort effect. And ultimately, we're giving them a digital megaphone, which just helps them spread their ideas. A second goal is to inject new ideas into the environmental health, science, and advocacy communities. Business as usual is not going to cut it for solving our world's most pressing problems, like global climate change and global social inequalities. Many of these things are also intertwined. We need bold, innovative ideas to push our planet in a healthy and more just direction. A last goal is around representation in the media. Representation really matters. Environmental health is a predominantly white field. And I think to really increase diversity and inclusion in the field, we need to broaden our perspectives and center non-white voices. So just a little bit about this first year of fellows. They're all early career scientists from backgrounds historically underrepresented in science and academia. We have doctoral students, postdocs, and research staff. There were 8 fellows from 5 different institutions across the country. The majority were in environmental health, but we do also have 1 fellow in ecology. And they really wrote about a range of topics. So here are their 4 pictures of their 4 blogs. We really encourage them to include visuals. They wrote about energy production and community health, the research process and the need to prioritize inclusion in environmental health research, the role of farming in the Black community, as well as cultural significance of fire within the Indigenous community. So really broad ranging, and we're gonna hear a lot more about their topics and their work. Just a little bit about the numbers. I know many of you, like myself, are quantitative in nature. So this year, since January 2020, we published 9 essays and blogs as part of this series. And you can find them all on the EHN website or on our website. Total views of all of these blogs combined is approaching 1 million views. So this is really amazing. We had a little over 850,000 in English and over 100,000 in Spanish. That's once again, we ended up doing the Spanish translations based on the recommendations of one of our fellows, Brenda Trejo. And I think it was a great idea just in terms of expanding reach. The median number of views per blog was 13,500, with the max being 885,000. And I just want to end by saying right now we're ramping up to do it again. So we are recruiting a new group of fellows for this next academic year. Applications are due at the end of August. And if you or you have trainees that are interested, you can go to our website link here to find out more. So thank you. Okay, so now, hold on, just let me pivot right quick, and we are going to get started with a moderated discussion. So, just see here. Oh, no, that's not what I want to do. Okay, so why don't we get started? Okay, so we have 4 fellows with us. Maybe each of you can kind of take a turn and just once again briefly introduce yourself, where you're at geographically, what institutions you're affiliated with, and tell us a bit more about the research you're working on these days. So Denise, do you want to kick it off?
Sure. So, hi everyone, my name is Denise Martinez. I'm a PhD candidate in ecology, and I'm currently at Davis, and I go to UC Davis, the University of California, Davis. So my research focuses on identifying policy and decision-making barriers to cultural fire practices in Native communities. So these practices are really vital for food and cultural sovereignty, as many of the plants that we burn are either traditional foods or used for traditional arts and ceremonial items such as baskets and regalia. So my dissertation is largely qualitative and will compose of interviews with cultural fire practitioners and their collaborators on governance and decision making. The other part of my work is making cultural fires happen and supporting that work when I can. And so one way that my research group does this is by helping coordinate cultural fire workshops with Native practitioners. We actually burn landscapes, and we help revitalize these plants in places where our Native practitioners want us to. So they actually lead the workshop, and we coordinate with them to bring students, decision makers, policy makers, as well as just Native youth and Native community members. So that's another aspect of my research that I'm excited about.
Great. Max?
Hi, everyone. My name is Max Ong, and I'm currently a postdoctoral research fellow at the University of Michigan in the Department of Biostatistics. And I earned my PhD in environmental health sciences, also at Michigan. And when I first entered the field of environmental health, I entered at a time with a lot of really exciting innovations in the area of exposomic research, which is one of the things that Dr. Zoda mentioned. And for the past few years, I've been really focusing on this particular problem of trying to understand how complex mixtures of environmental contamination can impact human health across the life course. And so in my postdoctoral work, one of the things I've been focusing on is really trying to take these complex mixtures and apply innovative tools in mediation analysis, which is an important tool for causal inference in epidemiology. And not only trying to apply these high-dimensional mediation approaches, but also making the code and the software publicly available so that other scholars and users can apply these methods in their approaches as well. So yeah, if anyone from the audience is interested in the intersection of environmental epidemiology and precision health data science, I encourage you to reach out to me afterwards and we can have further discussions offline.
Great. Brianna?
Hi, everyone. My name is Brianna Vannoy. I'm a research associate at George Washington University. I actually work for Dr. Zoda. I've worked with her for the last few years. And I completed my Master's of Public Health in Environmental Health Science and Policy at GW. So our work has really focused on understanding sort of the molecular, environmental, and social implications of uterine fibroids. I'm not sure who all is familiar with this condition, but fibroids are a gynecologic condition that disproportionately impacts Black women. And so we are really interested in understanding more about how environmental chemical exposures can impact fibroid pathogenesis, as well as the molecular signatures of fibroids and the social implications. So racism in gynecologic healthcare settings, stressors in daily life. And so my role as a research coordinator really involves the day-to-day interactions with our patients. And so it's really valuable to me to meet every single person that ends up becoming a data point in our study. It's something that I look forward to doing every single day. And so as we'll discuss more, I really wrote my blog on what my responses and reflections and feelings have been in the clinical research space, working directly with patients. And I think the need for more Black and Brown research staff, researchers, investigators that can really emphasize and highlight the importance of inclusion in our field, because Black and Brown communities are just burdened by a lot of environmental health issues that we study, and yet, unfortunately, they have been neglected in inclusion in these research spaces. And so I've been really privileged to be a part of this initiative to share more about why I'm passionate about that.
Thanks. Ashley?
Hi, everybody. So again, my name is Ashley, and I'm a PhD candidate at the Harvard T.H. Chan School of Public Health in the Department of Environmental Health with a concentration in environmental epidemiology. So broadly, my research looks at the impact of urban agriculture on mental health, spirituality, and collective agency of Black communities. I'm using a range of methods from spatial analysis to psychometric methods, also including some qualitative methods. So I'm doing a lot of focus groups, and I'm like really highlighting or trying to highlight the importance of mixed methods, particularly the importance of using qualitative data in epidemiology. I think it's really important for us to understand why we're asking certain questions, and even if we should be asking certain questions. And the people that I believe know best how to answer these questions are community members themselves. So my work is really trying to investigate what some of those drivers are of mental health, collective agency, community resilience, spirituality, and how urban agriculture plays a role in that. And largely these questions have come about in these research, these research aims have come about because this is what I've heard from my community. Forgot to mention that I am currently based in Philadelphia, which is my hometown. And yeah, so I guess we'll dig a little bit deeper into what we're studying and how we think these blogs have been impacting institutions, impacting people, impacting communities. So I'll let Dr. Zoda jump back in and ask some questions.
Thank you so much. What a breadth of interest and work you all are really doing. It really wholly encompasses this space and the intersections between environment and health. So kind of, Ashley, you left me with a great segue. Let's jump into, I think for all of you, it was the first time, this was your first experience kind of writing and publishing, something directly meant for the public. Can you talk about the experience of what it was like after you published, some of the feedback that you received? Was there any feedback that really surprised you? Yeah, just talk about that. And anyone can kind of jump in.
Well, I can start, but is that okay, Denise?
Yes,
I can start by saying it was just the process of writing was very scary. I think in academic settings, we are trained to sort of write in a very formal way. And so having to be vulnerable and personal and share your feelings about like how you really connect with the work, that was difficult. But once it was published and out for everyone to read, it felt validating to get such positive responses. For me, I shared this with my family members, many of whom had experienced fibroids in their life. And so the connection to my work is not just because I care generally about Black women, but because I care about the Black women in my family who have fibroids. And so for them to read the work and for them to read the personal connection that I had and share their feelings of like, wow, Brie, like, this is so important, this is so big. That was really validating and made all of the scary moments of having to be vulnerable worth it. And I will also say, I've learned recently that the blog has been shared in classroom settings and students are reading them and they have positive responses and feelings about it. And that is really awesome because I can speak for myself in saying that when I was in high school or even in college, I had no intentions of working in research. I didn't know what that meant to work in research or do research as a career. And so to be able to share my experience and people to see like what the day-to-day looks like, and it's not necessarily, you know, just sitting in a cubicle, you know, doing code, although some people do that. Like for me, that's not my experience. And so being able to share that, and maybe people can see themselves in some of the work that I do, has been really positive. So I would say that it's been a lot of the feelings that I had after putting myself out there.
Thank you. Others?
Yeah, I was gonna say that it was really challenging. I think that one of the things that was hard for me was that I used to do a lot of creative writing before grad school and then just kind of dropped off when I started. And I had never really tried to bring that sort of creative writing mindset to a conversation about my research, to try to explain things in a way that was more personable, that was more about, like Brianna said, like my feelings about my work, my connection to my work. So that was really challenging, and I didn't realize that it would be so hard, or that I had become so trained to kind of take that out of my work. So that was really great. I think my favorite piece of feedback was actually from an elder that we do the fire workshops with, Ron Good, that he loved it and he felt seen by it and he wanted to share it with people. And he said, well, now that I know you can write so good, I'm gonna ask you to write more things. And so that was just really nice, because I think it was a great way to, you know, to show that there's multiple ways that I can help community, and maybe this is one thing that I can do going into the future as well.
I'd agree with Denise. My favorite pieces of feedback were from elders and from youth. While I heard a lot of this blog, I found it for an assignment, and I stumbled across, you know, what you wrote, and I really understood it. It was written in a way that was accessible. And then from elders, I heard the same thing. I heard, wow, you really spoke to the things that we're experiencing. And for me, the most meaningful feedback actually came from community members, people who are a part of the Black farming community, Black folks in general who don't farm. That was incredibly meaningful to me, because the whole point of writing this was to communicate something to an audience that may not be familiar with the research that I do, that may not be familiar with Black farming in particular, and to hear from Black folks who don't farm that they got it, that they understood how these connections between urban agriculture weren't just, it wasn't something that was trendy. It was actually something that our people, our ancestors have done for hundreds and thousands of years. They've connected with the land in these ways that were spiritual, right? That helped with mental health, that gave them power, and that the fact that folks who are not in this work necessarily could understand that through what I wrote was incredibly powerful for me.
Thank you. Max?
Yeah, and then, you know, from my experience, I think having this platform to sort of integrate our lived experiences into the science that we do was incredible, because it allowed me to really discuss like tension points that I continue to observe, especially in my home community. And, you know, one of the feedback that I received was that this individual was saying that in their communities, they experience and observe the same type of tensions between, you know, fossil fuel industries and both the workers in those industries, but also the community residents that are affected by pollution. And so I think just having this platform has been incredible, and seeing how others can relate to it. And then bouncing off of what Brianna said, so I used Brianna's blog in one of my classes I was teaching, and the reaction from underrepresented students that they can see people like them publishing and conveying ideas that are about people like them is so important. And I think that this is sort of where we need to go forward, is this authentic amplification of underrepresented voices.
That is a good phrase, authentic amplification. I like that. So we've talked about kind of brought up that some of the blogs like Brianna's has been used or integrated into courses into, the curriculum. I know others have also, can you talk about opportunities that may have opened up as a result of publishing your essay? If you think it's increased the impact of your work? I think we've touched on that a little bit, but any opportunities that have kind of opened up?
I can share. Awkward silence. So yeah, the opportunities that have come as a result of this blog have completely blown me away. There have been a lot of news outlets, journals who've asked to republish it. So my blog, I think, has been republished at least 4 times in different journals, from a hometown journal, Grid Philly Magazine, to a rural journal called In These Times. So that, speaking to impact, like, it's exciting to see that the work that I wrote about kind of urban agriculture and the impacts it has on folks is reaching rural farmers as well. Also, I just had an interview with the news station here, CBS 3 News, yesterday. A reporter just randomly reached out and said, I don't know how I stumbled upon your blog, but I did. And I'd love to talk more about Black food sovereignty, particularly in the context of a pandemic. And I think that really kind of speaks to the impact that this work has, especially in this current context. And I might be jumping ahead a little bit, but for me in particular, like, COVID has really highlighted racism within the food system, right? Like, people, Black and brown folks, Indigenous folks in particular, are struggling with access to food. And one of the things that I'm trying to highlight through the work that I'm doing, the research and the blog and the activism, is that we need community control of the land. We need community control of our food systems, and we need to have power and agency over what we put in our bodies, right? So I think that a lot of these opportunities have come out of the blog and have come out and speak directly to the impact that the blog has had, particularly in this current context.
That's great. And we're going to switch gears to kind of talk about some of those broader issues. Just one last question from, like, a training perspective. Can you kind of talk a little bit about how this training and the type of writing and the writing kind of training and just the training in the program kind of differed from your academic training? And, so somebody had mentioned there's almost like a dissonance between kind of, what we were asking you to do and what maybe your programs are asking you to do, and how to maybe speak to that. But then also, can you speak to, like, how you might, like, moving forward, try to, like, integrate some of these diverse trainings into kind of your path forward? I don't know if that's too abstract.
Sure, I'll respond to this one. So I have to give incredible kudos to the fact that this special program, it's so incredible because of the design from the very beginning, like the design perspective that Dr. Zoda and Brian synthesized, and I think how it stands out from academic training is both of them were very intentional from the beginning about challenging us to write something, to give each other feedback, but then carry it towards the finish line, which is to find a place, an outlet to convey this information. And so I think that in itself is unique because, it's not just a final paper or, a final project, it's actually getting synthesized and sent outward so that the world can see it. And so I think that is one really special and unique thing so far about the program in regards to training.
I think this program also really helped me, like, the iterative drafts really helped me think through where my writing wasn't being clear, or where I was really like in my disciplinary like little hole and not really communicating outside of it. And I don't think I really realized how much I was doing that until I tried to not do it. So I think it's really helpful to have that. I also kind of realized that language that's straightforward and that's accessible is important for my work generally. So I have been kind of challenging myself to write that way in academic spaces, even if those spaces also require maybe like more theory or whatever, but language that is straightforward and that is accessible is important in order to have that work be accessible to the communities that I care about and that will use my research. So I think that has become clear to me in general.
Great. Okay, so now we're going to switch gears a little bit and kind of talk about just some broader issues. And Ashley kind of started us off a little bit on this, but you know, we're clearly in this unique moment between COVID and then a lot of the social and racial disparities that have been highlighted and amplified both by COVID and then police violence. And so, you know, many of you work on research related to environmental justice and health disparities. Has this, you know, kind of renewed attention to structural racism amplified your work in it or changed your work, or, you know, what has that meant for you as a researcher, as a professional in this moment? I know that's a deep question. You guys got it though.
It is a deep question, but I will say I don't think that the current issues around structural racism, police brutality changed my view of the work that I do in any way, because in a lot of ways, these things are always happening, and maybe just not on Twitter or not on, you know, the nightly news every night. But for, I think, Black and Brown and Indigenous communities, a lot of these issues were at the forefront of our daily lives. And so in my blog, I talked about structural racism in the context of healthcare settings, so and in the context of clinical research studies. So either mistreatment in research studies or, you know, racism in healthcare settings, or racism and sexism for women seeking gynecologic care. And so these things, in my view, have been going on, you know, for, you know, since my ancestors were brought here against their will. And so I think that it's great now that as some of these issues are being amplified through, you know, various sources, that people are seeking out more information about these issues. And so in a way, it was really great to have our work sort of we were already working on a lot of these blogs and already thinking about a lot of these issues. And in this moment, so many people who were craving more information, who wanted to learn more about some of the issues that we focused on in our writing, referenced our blogs to learn more about, you know, racism in health, or racism in, you know, food access, or in, you know, cultural practices. So for me, it didn't change my view of the work that I do or the importance of the work that I do, but I think that this moment has provided a platform for people who maybe would not have otherwise engaged with this sort of article topic, to click and read more and learn more and share. So, you know, it's been interesting to see that kind of play out.
Yeah.
I think similar to Ashley and Brianna, I think that COVID-19 in specific has brought to light a lot of the environmental injustices and health disparities that occur in Native communities. For example, just when people that I work with Native people that I work with, a lot of times they talk about food sovereignty, and people are saying, well, why are you looking for food in the forest? All of these really like ignorant things, but really food sovereignty and traditional foods are what keep our communities healthy. And so they're vital to our communities. And now with COVID-19, we see, the diabetes rate in Native communities is so high, and that's a comorbidity. And we're seeing, communities like the Navajo are, poisoned by uranium, and we're seeing the impacts of COVID in their communities too. And so it's just all of these issues that used to be seen as kind of separate are now like together, and people are understanding the connections and the way that they're important in a more lived reality kind of way instead of a hypothetical way.
Max or Ashley, do you want to address this one, or should I keep going?
I think just, very briefly, one thing from Brianna's blog that has resonated with me a lot and reinforced this idea that, in this tremendous expansion of precision health research and these large omic scale research studies, that it's so critical that we have representation of racial minority groups in these large studies. And so it's for me, from a research perspective within this current context of structural racism, I think like it has really enhanced my commitment to trying to better advance precision health while trying to ensure that it's encompassing multiple different racial groups, and so that it's not just predominantly white participants, such as what we've seen so far.
Yeah, and so I think that kind of leads me to the next set of questions, and that's really about how does your scientific training and or your specific scientific work, either how do you see it connected to equity and inclusion, or like your specific activism? So how are can some of you talk about explicit connections between the science you do and either your activism or more broad goals around health equity and environmental justice? Ashley, do you want to kind of talk about those connections with your work?
Sure. I think that all of our institutions are inherently racist and white supremacist. So we are working against forces that, one, don't want us to be in those spaces, and we are working against institutions that honestly don't care about our communities. So I'm sorry if this is unpopular. One thing that I've been hearing coming out of communities a lot lately is that we keep getting the same, or researchers and institutions keep getting all of this funding from funders to answer questions that we already know the answers to. So at best, I think what we can do, and what I am trying to do, is to value and amplify the voices of community members in asking the research questions that they want to ask and answering them in the ways that they want to answer them. And I'm trying really hard to listen to, to step back and not bring my researcher hat up front until it's requested, right? And I think a lot of times we have a tendency to go in this is what we think we should do. This is what we think you need. And the reality is that Black and brown folks, Indigenous folks, these communities have all of the tools, all of the knowledge, all of the resources, or all of the wisdom to answer the questions and heal their communities. We've deprived them of the resources. So I think my work is really at the intersection of trying to bring the resources that I have behind me with Harvard being probably top 3 wealthiest institutions in the world, to the community that I am a part of, and asking them, how would you like me to use these resources? How do I contribute to the healing mentally, spiritually, physically of our community? So I'm not sure if I fully answered the question.
Okay. Can I ask you a follow-up question? I think that's a great big picture. Can you get just a little bit more granular? So can you talk about, like, are there certain, like, scientific questions? So you kind of talked about the process that you, along with the community you work in, have like kind of honed in on that they want answered, that you're hoping to tackle? And can you kind of talk about how they might use that knowledge that you generate?
Yeah. So I guess one example is that when I was first sitting down to really think about what dissertation questions I'm going to ask, I had one set of questions that was like, I'm interested in how urban ag impacts physical health. And I took this to folks at Soil Generation, folks at Sankofa Community Farm, different farms and food justice organizations in Philly that are led by Black folks. And I was told, that question, we don't think you're gonna, like, why are you asking that? Like, we know that it takes time to see documented impacts of physical health changes. But this is not all that agriculture does for us. Agriculture is so much more for more than physical health outcomes for us. It shows us how to reclaim relationship that we have with the land and with our ancestors. Like, there's this whole spiritual piece that I wasn't even aware of, right? Because I've been away from the grassroots work for like 5 years now. And it wasn't until I went back, like, hey, these are the questions I want to ask, that folks were like, nah, don't ask those questions. What would be meaningful for us is if we could show the spiritual impacts, if we could show the mental health impacts, if we could show how these spaces protect us from systematic racism, such as police violence, right? So after hearing that and like having those conversations, I was like, okay, I gotta go back to the drawing board and completely shift how I'm asking these questions. So I don't know.
That's okay. Yeah.
Okay.
Anybody else?
I want to approach your question from a different dimension.
That's great.
Which is like, because you're talking about sort of challenging institutions, and I think like one problem that I've dedicated a significant amount of my professional career on is this issue of retaining and supporting underrepresented students in STEM and in public health. I think the field lacks diversity at the faculty level, at the leadership level, and I think one way that we can really support this is by ensuring a strong pipeline of support for underrepresented students at the undergraduate level, all the way throughout PhD and postdoc and so on. And so, I've been working on this with either through teaching and pipeline programs or with mentorship programs. And more recently, I'm working on addressing this issue with my professional society, International Society for Environmental Epidemiology. And we've been discussing this major issue of a lack of diversity within this at the PhD level for environmental epidemiologists, and how we really need to create structures and programming that can bring in students early on and provide them with the necessary tools so that they can succeed in this field. And so I think that's another way we can combat this problem from the academic vantage point as well.
Definitely. I mean, there's with both of your comments, there's so much to unpack. And I hope that the Q&A from the audience will help get you there. I do want to give Denise and Brianna a chance to kind of comment on any constellation of these types of issues. You can also get into, also if there's a policy dimension of the work you're trying to, that is part of the kind of change you're trying to create. Go ahead, Denise.
Yeah, I was just going to jump in and say that I had a similar experience to Ashley. So I have been working in some capacity with the Karuk tribe for past 6 years as an undergrad research intern first, and then as a collaborator. And I also brought a set of questions to them and they rejected them. And I think that that amount of accountability is kind of our role as scholars who view ourselves as community-based scholars or maybe scholar activists, is that we need to hold space for that sort of tension and community input, and also hold space for things like for example, in my case, I'm holding space for Indigenous science to be in conversation with Western science, and sometimes it's not really welcome. And so I kind of have to hold that bridge sometimes to between those two worlds, and really to bring in community perspectives and see them as experts and not as just, like consultants.
Yeah.
Yeah.
I mean, so I have a follow-up question for you. I mean, how are you learning how to integrate these tensions, right? I mean, that's like a pretty unique skill set that, right? I mean, no one necessarily is teaching you. I'm just kind of, like, are you just kind of trying different things and kind of seeing what works? Do you have people to talk to help you navigate that, that in-between space?
Yeah, my advisor is a huge help. I think also there's a lot of Indigenous people in policy spaces, people that are heading their own environmental science departments for their tribes that are navigating this tension maybe in a different space around agency scientists like US Forest Service and CAL FIRE and their own tribes' traditional knowledge. So they're kind of in that space too. And I learn a lot from them about how to navigate, about when not to compromise, about when to hold my own. I think there's also a lot of Indigenous scholars that I really look up to. But at the end of the day, it is also just about holding a love for the people that you work with, about holding, kind of holding your sacred ground, like really standing in it and saying, like, this is my truth, and being comfortable with being uncomfortable and having those conversations. It's not always easy, but I think that it's important. And so I stay engaged in it. And I think that that's my biggest piece of advice and what I've learned from others.
And Max, I have one question for you too, going back to the work you're doing with professional societies and more established institutions, which I think is so important. I mean, and I think they're, getting students in is one problem. Keeping them in and, creating space for more diverse leadership is a whole nother issue that I think in some ways is almost even more harder to tackle. But, what has been the reception to your efforts, and especially if you ever take like a critical approach to what people are already, like the practices that have already been done?
Are you talking?
To Max, sorry.
Yeah.
Yeah, sorry, that's Max. I jumped back, sorry.
Yeah. I think so far the reception has been, it's been pretty open, especially from the society perspective. And I think part of it has to do with the current climate and the tension of the current climate and how I think society is demanding change, and so and I think as science leaders, either in academia, government, or whatever, I think I think there is room where folks are open to adapting. And so the conversations that I've been engaging in so far have been productive. And I am optimistic that, you know, we can collaborate, you know, within the society, but also outside of the society to make these paths, you know, more sustainable and bring folks from underrepresented groups and really occupying this space, this academic space that really just lacks diversity at this current moment.
Brianna, is there anything you want to add to this?
This is great. No, not really. I mean, in my work, I tried to echo these things that these wonderful scholars have shared in terms of just really simply the voices of the patients that I work with. And so that's, you know, although our questions are already formulated in a lot of ways, it's still very much, as Dr. Zoda can attest to, an iterative process where we're always learning and growing and adding more and making changes as in response to the things that we hear from the women that we interact with and the women that we work with. And so, you know, we're always looking to hear more, you know, in response to patients who are really interested in this connection between chemicals and reproductive health. We were like, okay, we need to provide some resources for women to learn more, because like I was getting bombarded with questions on a daily basis, just, you know, in the hospital, speaking with people about our study. And so I think there's always room to talk and listen and really learn and then make changes in response to those conversations and not feel, I guess, like you have to stick with the status quo or stick with the protocol and not think about or be creative in ways that you can change to make this better. Like, you know, although in the traditional sense, our clinical study at this hospital is not community-based participatory research, like I still consider it to be like a community engagement project, because like I'm always looking for ways that we can engage with the people that we are studying. And I hope that the women that we recruit feel more like they are a part of it rather than just like me as a researcher asking them to do something. And so, you know, I think that whether you're in the field, if you're just at the beginning stages of formulating your research questions, or if you're, you know, in a clinical environment, I think there's always room to center the communities that you aim to help. And continuously be engaged in these sorts of conversations and in this sort of development. So that's all I would add, really.
That's great. And we have about 10 minutes where we're gonna have some time for some questions from the audience. I just wanna, end my moderated piece by saying, we have like the kind of hokey tagline about, future leaders, but hearing this conversation, working with you guys over the last year, I mean, to me, you all have such amazing leadership qualities, especially how you're, navigating these, you're trying to bridge so many different spaces, both from your personal backgrounds to the different worlds you're bringing together. You're finding new solutions. You're not compromising, and you're not just taking what was done previously as a status quo. You're looking for the next iteration. And so to me, those are all qualities of leaders in the field. So, and you're all doing it in very different way on very different landscapes, which I think is also really important, whether it's, in the community, in the clinic, in academic institutions. So with that, I think I'll hand it over to Karen, who will take a few questions from the audience. Is that right?
Yes. Yeah. If you guys have questions from the audience, please type them into the Q&A box and I'll be reading some of them off. We had one question about if you have Twitter, could you please share your Twitter handle? And also maybe one or two of you guys can address how you use social media and avoid the pitfalls of social media.
Well, so for the Twitter handles, are they on your website, or could we put them on the website?
We can put them on the website, yeah.
So yeah, why don't you guys, just for the sake of time, take the second question about social media? Because I don't think they can see what you all write in the chat. Is that right?
No, but if you chat them to us, we'll put them on the website.
Okay, so you can do that too. And then you could just put them in the chat box and then answer the question about social media.
I think I use social media to follow a lot of climate activists and trying to stay connected to broader grassroots movements that way. It can be like there's a lot of pitfalls around respectability politics and around what you share and, you know, putting out a professional image. I'm not sure I have the solutions to those things. I try to be authentic. I also try not to get like my public Twitter handle, like I try to be authentic there, and I try not to share too much of my life personally, because some people I just don't know personally, but I think that that's a space for me to be a scholar, but I don't necessarily think that I censor myself, because I think to some extent respectability politics are a way to exclude scholars of color who maybe don't fit what people think of as a scholar.
Yeah, on the Twitter front, I've recently been really active on Twitter for the past couple of years, and I helped create Twitter accounts for the labs I'm in a part of, and you know, I think like and everyone will approach this slightly differently, but from my perspective, I generally keep that platform as like a professional place where it's mostly focused on authentic amplification, or it's focused on, you know, sharing new news, research articles, and, you know, and just keeping up to date with some other leaders in the field. So yeah, it's definitely more of a professional setting in that regard.
Great. We have another question. I love the phrase scholar activist. Do you guys have any thoughts about how we can make this the norm rather than the exception throughout academia and research?
I'm not sure. Like, I don't have all the answers, but I think that the first step really should be acknowledging the ways in which academia has been complicit in white supremacy and settler colonialism, and the ways that it continues to do so. So acknowledging that and actually doing something about it as institutions and as scholars. I think scholar activism only means something if you're working with a community, or if you're having, you know, kind of challenging whose knowledge matters and whose perspectives matter. Because without that community accountability, it's hard to know if your activism is effective or working. That's what I would say, I guess.
Can I add something to that?
Yeah.
I think I just want to, I think part of it too is we have to change the incentive structure within academia and for scientists. We have to incentivize and value impact on real, like on actually creating public health change and, improving communities' lives, like, that actual implementation of improving people's lives directly, that I think that has to be incentivized more. So I think that the whole incentive structure has to adapt and change, in my opinion, anyway.
Great. We had a question. I am a white woman. I'm loving this conversation. Can you provide me some advice on how I can amplify neglected voices in my own community?
I think one way that you can approach this is by, if you are in a leadership role, leveraging your social capital to create opportunity structures for underrepresented folks. I think that is like a very great first step, and creating opportunity structures and listening. I think like listening to what those emerging leaders have to say, and I think that can really have profound ripple effects throughout their careers and in your community as well.
Great.
I think I would, oh.
Go ahead.
The only thing I would add is to show up to community spaces, whether it's activist spaces or community spaces, very firmly as a student or as a person that is learning, that doesn't know everything. And I think that showing up in that way allows for you to start seeing these communities as people you care about, people you know, and it's not so, it doesn't always have to be so top down about power, about sharing your power in like a top down kind of way. It could also be about joining your power with people who are already doing the work.
Great. We talked about the underrepresentation of people of color in environmental health. So I was wondering if you guys could share, maybe not all of you, but one or two of you could share about how you got interested in environmental health. Why did you decide to become a researcher or scientist in this field?
Okay, I'll start. This is a loaded question because I did not have an epiphany moment. Like there wasn't one thing that occurred in life that was like, this is why I want to do this. But it was really just a compilation over the years of seeing issues that I cared about, impacting the people that I cared about. And when I was in college, I got involved with environmental research, health research. I thought that I thought that was the best thing for me to do at the time. I was kind of checking off boxes in terms of pursuing a different career. And so I got involved with this research study, but then I realized like, whoa, this is actually really great. It was focused on a community in the south side of Columbus who was being impacted by a power plant that was neighboring their community, and they were concerned about exposures, in the air from this neighboring community. And it had a big impact on me because it was the first time that I was able to engage with this community. We had monthly health advisory meetings with community leaders and local officials. And there I really saw the importance of like prolonged community engagement, advocacy, and science all at work to try to address this issue. The community had one ask, which was to have an air monitor put next to the local school. And yet it took our work in toxicology lab along with public health officials and state officials and community leaders really charging the way for this to happen. And so I saw the importance of the work that environmental health researchers do, and that really kind of set me on this path of being more interested in environmental health. And so I would say it's really been my interest in working with Black and Brown communities, and then also seeing how we can use the tools in public health to really address some of these issues that burden us. And so, yeah.
Great, thanks. And another question we kind of got in some form, and putting them kind of together, is what are some best practices or insights you guys can share about sharing scientific knowledge or research results or the process with the communities that you work with?
One thing that I'll quickly say is that throughout this writing process, one thing that I appreciated about Dr. Zoda and Brian is that they constantly reminded me to go back and simplify language. It was easy, and I feel like I've been trying really hard to speak from my voice, the voice that I communicate in Philly with my family, with my friends. I've been trying to bring that voice into academia, although it's often not valued. So I feel like I try to speak simply, and they reminded me like, hey, what are you talking about? Qualitative approaches such as community, blah, 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 blah. And I had to go back and I'm like, okay, this is really helpful. Like I need to continue to reread language and the things that I write to simplify them. But also it's really important to have peers review your stuff, right? Because you're reading it from your own perspective. You have whatever lens, and you need to have other people outside of your own bubble reading this thing and making sure it makes sense.
I think I'll answer the question. Maybe the question was around sharing with the communities we work with, correct? Okay, so I think that's really important, especially I think a lot of researchers, after they finish their project with the community, they'll publish something in an academic journal and like be done. But I think that something really important is to actually talk about research products beforehand. So maybe it is an academic journal that the community wants. Maybe it's a policy memo. Maybe it's a presentation to the broader community on what you found. And talking about that beforehand is really important. Even just for your own, what you have in mind for your own workflow, et cetera. But it's a good way to set up expectations for after, so you don't just kind of leave and, are never to be seen. Because that happens a lot in the communities I work with. Researchers come, they ask all these questions, they promise all these things, and then you just never hear from them again. So another really important thing is data sovereignty. So what are you going to do with the data? Can it be shared? Can it be, held in a community library? All of those are questions that need to be reviewed both ethically for each individual, right? So you don't want to share data that's confidential or anything like that, but also just, is it ethical for you to own a piece of a community's knowledge without sharing it ever? There's horror stories about, Kaduk stories being in like operas because people were not, they called and asked and they said, well, I don't really have to ask you because I own the data. So these things are not okay. They might be fly by past the IRB, but they're not okay ethically. So thinking through that beforehand is really important.
Yeah, great points. Okay, we are a little bit over, but I'll close with one last question. If you guys could share a little bit about what you've learned from each other during this process, from your fellows, that would be great.
I know you guys have something to say on this, so come on. Because you all talked about how important it was to have the cohort and the feedback, so.
Yeah, so I think it's invaluable to have a group of scholars of color, period. And like, I think just ending, just the camaraderie, the ability to talk through what we're going through, seeing others, be bold and non-compromising with the way they talk about their work. I think all of that was deeply inspiring, and it was amazing to, have a new group of friends to talk to when something happened, at my home institution, or I just want to talk through this professional thing. I think having a community, even if we're all far away from each other, is incredibly important.
In addition to being just in a virtual room full of, scholars, I personally felt like every single week was like a class lesson. Like I was learning just about a new topic that I maybe didn't know anything about or only had a very surface level understanding of. And so each blog that I read, each draft blog that I read was like informing me on an issue or a topic that I didn't previously think critically about, or I hadn't previously connected the dots that another fellow in the program connected. And so for me, like, although I was learning how to write in this way and I was learning how to express, my responses to my own work, I learned so much from each of the individual, skills and expertise that are represented within the group. And I feel like a more informed environmental health researcher because I learned what other scholars in my field are doing. And so that to me was like, I'm like, what other place am I going to get every week to like learn about something that I previously had no idea about, and it's broken down in a way that like is accessible to people that I can understand. So that was really powerful for me.
Yeah, I think, in academic settings and in any like major institution or organization, there are norms, right, that exist, and we operate in these within these professional norms. But I think what was special about this environment is I feel like we created our own table, and we like co-created a set of norms that were a lot more inclusive. It was a lot more inclusive environment where I felt like I was able to be really vulnerable. And I also saw my colleagues very vulnerable, and it was sometimes really emotional. I got super emotional reading their blogs as we were like workshopping them. And so I think in this process, what I learned is that being personal and being vulnerable really can enhance the process of connecting your lived experiences with your science.
Okay, great. I think that's the end of our webinar today. Hannah, I'll hand it back over to you.
Can I say one thing?
Oh, sure, yes.
Well, I want to say thank you to you all, but if the audience hasn't, I really encourage them to read these blogs, and to keep an eye out for the other work that these fellows will be doing, both through their publications and through other avenues. So I don't think this is the last time we'll hear from them, but definitely, check out these blogs as well as those of the fellows that hopefully will be joining us in the fall.
Yes. Thank you.
Great. I just want to thank all of you for making yourselves vulnerable and for sharing all of your lived experiences and the science behind it. With that, I want to thank you too, Karen, for moderating. We're approaching the end of today's webinar. A video recording of this is available on CHE's website soon, and tomorrow you'll be receiving an email containing the link to the video. The next CHE Partnership webinar will take place on August 5th and is titled Improving Water Quality in Schools and Childcare Facilities During COVID-19. To learn more and to RSVP, please visit our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate these CHE Partnership webinars bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, that website is healthandenvironment.org. With that, I would like to thank our speakers, Dr. Amy Zoda, Brianna Vannoy, Ashley Gripper, Denise Martinez, and Dr. Max Ong for taking time to present today, and to you, Karen, for your excellent moderation. Thank you so much for joining us. Have a great day. Stay well and healthy.